Hi there, I'm Dr. Qadri. Let's do a question. All right, so I had answered this one. Let's go to the next one. Okay. A 38-year-old woman with a large thyroid adenoma confined to the lower pole of the left thyroid lobe undergoes a left hemithyroidectomy. During dissection of the inferior pole, the surgeon identifies an artery entering the gland that arises from a branch of the subclavian artery and must be ligated to control the bleeding. Which of the following arteries must be ligated? So basically we're looking at what artery supplies the lower pole of the left thyroid lobe. Okay. And from these options, it's probably not the superior thyroid artery. Lingual artery goes to the tongue, so it's probably inferior. Thyroid ema artery, I think that goes in the middle, so I don't think that's what it is. Superior laryngeal artery also probably not, although it could be related, but I think it's inferior thyroid because inferior thyroid pole, right? There you go. Just simple logic. Forgetting the anatomy entirely, but just logic. But yeah, inferior thyroid artery is a branch of the thyrocervical trunk, which in turn arises from the subclavian artery. It supplies the inferior pole to the thyroid gland and parathyroids as well, and is the main vessel encountered at the inferior thyroid pole during surgery. Lingual goes to the tongue. Superior thyroid gives branches to superior pole. Thyroid ema artery arises in some individuals from the brachiocephalic trunk or the aortic arch and supplies the isthmus or the middle, basically, of the thyroid gland. It does not typically originate from a branch of the subclavian, actually. And superior laryngeal is a branch of the superior thyroid artery, which itself is a branch of the external carotid, that supplies the mucosa of the larynx. Okay, great. All right, sounds good. Thank you.